How do you know if you're exercising too hard? Your effort is too intense if you can't exercise and talk at the same time, if you notice that you're feeling so tired well over an hour after you're done your exercise, if you get frequent muscle or joint soreness that just doesn't seem to go away, if you're experiencing dizziness during or shortly after you've done your exercise, developing an intense headache or symptoms of nausea during your exercise, or if you notice that your heart rate after cool down is still more than 20 beats per minute over your resting heart rate. Those are all signs that you might be going at an intensity that your body is not quite ready to sustain at this time. What's an abnormal response to exercise? Any type of chest pain, angina, pressure in your chest, arm, teeth, jaw, neck, and back. If you've had a heart attack before, angina symptoms would be similar to what you felt when you had your heart attack, but possibly a milder form. Obviously, fainting, being very dizzy, feeling palpitations or irregular heartbeats, and being extremely short of breath or even wheezing are all abnormal response to exercise. If you have any of those symptoms, stop your exercise immediately. What should you do if you have angina? Angina happens when there's not enough oxygen getting to the heart muscle. It usually happens with activity or stress and is usually relieved with rest. If it does not relieve with rest, that's when you need to use your nitro spray. So if you experience angina symptoms during your exercise session, stop the exercise and rest for 5 minutes. If the angina is still present, take your nitro spray as prescribed and wait another 5 minutes. If the angina is still present, take another dose of nitro spray and wait another 5 minutes. If the angina is still present, you need to call 911 and take your third spray of nitro. So to recap, you're allowed to take 3 sprays of nitro spray, waiting 5 minutes in between. So a total of 15 minutes will have elapsed with you still having chest pain. It's very important to call 911 as your blood pressure will get very low with the nitro. So you do not want to drive yourself to the emergency. If you're experiencing extreme shortness of breath while you're exercising, stop the exercise and rest. Use the pursed lip breathing technique. Take your rescue inhaler as prescribed. You might want to discuss using your rescue inhaler before you start your exercise with your primary care provider. Here's how to do the pursed lip breathing technique. You breathe in through the nose for 1 to 2 seconds. Purse your lips as if you were to whistle and breathe out slowly for 3 to 4 seconds. Your breath out needs to be longer than your breath in, but it should not be forced. Breathing in this fashion when you're sitting and resting will help you to recover from your shortness of breath much faster. Here are some positions that can also help you relieve shortness of breath. You need to make sure that your arms or upper body is supported by either your body or a table, a chair, or a wall. You can also use the pursed lip breathing technique when you're using those positions.